In this video I will show you how to extract a 108 using only an envelope flap, so no releasing incisions, no excessive drilling, just a very non-invasive way of doing this extraction. So first you take your size 15 scalpel and you make those stabbing incisions all around the tooth to release the gingiva. I'm just going to remove this little slab here. This was a complicated slab fracture, usually from chewing onto inappropriate things. So I'm doing the release here with my periostal elevator, so just releasing that gingiva enough that I can go down with my 701L surgical length burr and remove the alveolar bone. And I just make some sweeping motions across the roots here to expose where the furcation is, so I can see where the roots are in comparison to the bone, and make that cut through that tooth. So I'm sectioning this way, and then after I section all the way through here, I will go section the mesial roots also. So you want to follow that ridge that is right here. You see that where that burr is, that little ridge or edge on that crown that leads you straight into the spot where you will section. So go a little bit deep, maybe like 5-6 millimeters deep, to make sure that you split those roots. So now you basically just have 3 single rooted extractions, because 3 roots, and do as normal. Go in with your luxation and elevation instruments to loosen them. This distal root was quite loose already, so you see just by putting force here I could get it quite loose, and just a rotation and pull and it's gonna come out. This was Bichon Havanese type dog, so these teeth are more forgiving, I think, usually in getting them out closed. So now I'm going in with a very sharp, thin luxating instrument, and I'm just cutting that periodontal ligament next to that mesial root, to the mesiobuccal root here. I'm finding that space where the periodontal ligament is and going in with my luxator, making some space to later go in with a thicker instrument. Now I'm going to work a little bit on the palatal root. This root can be a little bit tricky because sometimes it goes one way, sometimes it goes the other way. So you gotta feel your way in, like what is the direction. Usually it goes quite caudal, like here. Okay, so now I'm going in with a thicker luxating instrument where I'm allowed to actually twist a little bit to elevate. So I always start with the very thin ones and go in with this one after, or you could use an elevator or a winged elevator, whatever you prefer. When you're in that spot between the tooth and the bone, you want to hold the pressure. So try to hold it for at least 10 seconds, because that will fatigue the fibers and they will start to loosen. So I was happy with the looseness of that buccal root, but I immediately after went to work on the palatal root. And here is where you see me slow down, because this requires more patience. So basically I'm trying to get this instrument in between the bone and the root. Once I feel it's snug in there, it's kind of tight, then I do a 1/16 of a rotation until it still feels tight, and then I just wait. So you see me here doing this, rotate a little bit and then hold the pressure, like right here. The reason why I'm just holding it with a 2-finger pressure is that I'm fatiguing the periodontal ligaments, and they will start to bleed a little bit. That's a great sign, means you are in the right spot. And you can increase the pressure slightly. You see here, just holding that pressure, and you want to work 360 degrees around that root, because suddenly you're gonna find that magic spot where the root is just gonna kind of pop out sometimes on itself. So I'm working, the hardest spot for this root is palatally. So I'll try to work mesial and distal, so front and back. And now I'm just... So you can experiment with clockwise turns and counterclockwise turns and see what works best for this particular tooth. It's all about getting that the correct angle. And now you see, now it just wants to come out. So I'm grabbing it with my extraction forceps and it's quite loose. You see it's a little bit curved and a little bit thin, but it was nice and round and the root tip was still intact. I'm gonna grab that other root that I know is gonna be loose. So you are allowed to rotate and pull. Actually, you have to do that quite often, rotate and pull. So don't be afraid to rotate and pull. And now I go in with a, I think it's called a Lucas curette or a surgical curette, just to scrape out some of that granulation tissue and the debris and parts of some calculus and stuff that may be in there. Scrape that out and you can see I just tested with my fingers. Is this going to be able to close without tension? And yes, absolutely. This is very much without tension. So I just put a suture through. This is a 4/0 monocryl. So it's a purple dyed monocryl suture. And I just start here. And as you can see, it actually reaches to close that defect fully. What if the flap would not reach and close the extraction site fully? Well, you could actually just leave it partially open. Unless there's an oronasal fistula, then you would like to close it properly. But in most cases you can, like a partial closure is also okay. Things will heal very quickly. The more you manipulate with the flap, the more you release the periosteum, the more you cut and undermine and dissect, the more pain and swelling this dog is gonna have afterwards. So if you can do a more minimally invasive procedure like this, then that's preferable. And you can see I did the same thing here on the canine tooth. I also got that out without making big flaps. So for the smaller type dogs, the Bichons and the Coton, the Tuliar dogs, and usually their canine teeth are straight and you can get them out without a big flap. Same goes for Yorkies and Chihuahuas, and you don't have to make big flaps for that. So that concludes the surgery, and you can see here that it's nicely sutured. All right, we got one more to go. You want to place your sutures about 3 millimeters apart and take 3 millimeter bites. I'll just use simple interrupted. Could you do a continuous? Yeah, sure, you could. But I feel a little bit safer with simple continued sutures or simple interrupted. So if you want to watch that video where I extracted that canine tooth without making a flap, it's right here. Just click this link and go see how I did it.